I call on Government Order of the Day number 2.
Appropriation 2015-16 Estimates Bill, committee stage continued.
I declare the House in committee for further consideration of the Appropriation 2015-16 Estimates Bill. Mr. Chairman.
Mr. Speaker. Right. I need a sheet telling me who's got what. Okay. The House and Committee for consideration of the Appropriation 2015-16 Estimates Bill. When we were last progressing the estimates debate, we were debating vote in health sector, volume B5, volume 6, vote health.
Mr. Chair.
Dr. Jonathan Coleman.
Mr. Chair, it's not that long ago when we were in the middle of a health crisis in New Zealand. It seems hard to believe now, but people listening at home will remember a time when you'd turn up to North Shore Hospital, where the people of the North Coast electorate go to, and you would be greeted by a queue of ambulances in the car park, lined up, trying to get the patients into the ED. And then if you got through the car park past those ambulances, you would go into the waiting room and you would find people waiting on trolleys under harsh fluorescent lights who'd been there waiting for up to 24 hours. And meanwhile, you'd come into the chamber here, I can remember it well, we were in opposition, and you'd hear health ministers blustering about the success of the Labor government. But in actual fact, the rhetoric just didn't match what was happening out on the ground. Because while Annette King and Pete Hodgson were in here boasting of false achievements that never really happened, that just didn't take place, out there in New Zealand, the public knew the reality because they were going to the airports and getting on the jet planes to fly to Australia for basic cancer treatment. There were 30,000 people out there who were kicked off surgical waiting lists under the reign of Pete Hodgson and Annette King. That was the fact of it. People could not get the care they needed. There were so many people waiting on those surgical wait lists over 6 months that in the end, Labor just canned the wait lists and told everybody to go home. Well, help was on the way. 2008 election, it arrived. And since then, this national government has had a consistent history of putting in more money into the budget each year. Record increase, 15.9 billion vote. $4.1 billion has gone in over the last 7 years. But the most important thing has been the solid stewardship, the results that has delivered. Labor were pouring money in, but getting worse and worse results. They doubled the health budget, but they delivered 5,000 fewer appointments, 2,000 fewer operations. It got so bad that in September 2005, as Mrs King's reign was drawing to a close, the Dominion Post wrote an editorial and they said, how can you pour so much money into a health system and yet it still gets worse? No one could understand it. It was just incompetent management. Since then, what have we seen? Under National, 5,000 extra doctors and nurses in the system. 50,000 more appointments, 45,000 more elective operations. No one going to Australia for basic cancer care. We've set very clear targets and we're delivering on them. So under Labor, they weren't even counting what kids were getting immunised. Now we started off a base of in the mid 70%. We are having nearly 95% of 8-month-olds fully immunised. 95% of people in and out of EDs within 6 hours. We've achieved the first cancer care target. We've now moved on to a new one, the gold standard 62-day pathway, and we're determined we make progress against that. recording smoking rates, cardiovascular data. It's all improved under National. We've actually delivered what the public really care about. And just with this budget, there's been some great initiatives. So another $98 million into surgery over the next few years, $76 million into palliative care. A lot of that money is going into the community, so delivering nurse specialists, delivering care closer to home. These are the things that New Zealanders are telling us are important. But you know what the ultimate prize has been? It's been the free under-13s, a policy that Labor could only ever talk about, but they never delivered. And so we've now got 750,000 children in New Zealand under the age of 13 who are getting free GP visits, and we know that is going to make a real difference to the health of those children. So that is a signal achievement. This government has put in $120 million over the next 4 years to deliver that. In the meantime, all Labor can do is try and make up statistics and look for leaked papers. We have had no policy work from the Labor Party in health. We know they're not ready for government because we haven't seen any work. They don't go around the sector. What they do, they go around trying to corrupt officials and steal papers and then make up figures.
Member, resume his seat. I think the member knows that accusing people of requiring or asking people to steal things is not parliamentary. The member will withdraw.
I withdraw. But the essential point is Labor poured more and more money in, but they did not run the system properly. And you can see what a raw nerve this is, because Grant Robertson's losing it. Grant has completely lost it. Nationals won on health. Labor lost. Labor did. You can hear Grant Robertson yelling and raving here. He knows he's lost the debate.